This is a healthcare issue.
It is probably the most under-recognized public health issue that we are currently facing.
And we have as much responsibility to address domestic violence as we do cardiac pain, respiratory illness, gastrointestinal problems.
About 50% of the children who grow up in homes where there's domestic violence will also be the direct victims of physical abuse themselves. And so identifying and intervening on behalf of battered women becomes a very effective means of preventing child abuse as well.
It's kind of amazing to me, in fact, that I never noticed in my practice this problem until I started to read about it.
Certainly, intimate partner violence dramatically affects people's health. So all the chronic abdominal pain, chronic pelvic pain, chronic headaches.
Depression, anxiety, suicide attempts.
Preterm labors, the vaginal bleeding, blunt trauma to the abdomen.
Children that are having sleep disturbances, children that are having difficulty at a preschool.
And then later on, the drug use. So we know that the hidden costs beyond the hospitalization, beyond the visit to the emergency room, are just enormous.
Failing to make the diagnosis just wastes money and resources in futile expenditures down hallways that have no end.
You have to ask, because if you keep tracing down all the side effects of the root cause, you'll never fix it. It'll move on maybe to a different department. It'll move from your OB/GYN department to your gastrointestinal department, to your neurology department. It'll move through your institution, but the patient has not been served.
Patients are very relieved to be asked these questions and want to discuss their abuse.
A significant portion of the billions and billions of dollars we're spending on healthcare is related to domestic violence. I think the healthcare industry is in prime position to make a major difference